Hello everyone, my name is Katie Lane and I am with Truven Health Analytics. Truven Health is the education, training, and assistance contractor for the MACPro system. I'll be walking through this demonstration with you today, and the purpose of this session is to help you understand how to create, review, and submit a Health Home State Plan Amendment or SPA submission package in MACPro. So this call is on presentation mode now to prevent background noises, and there will be opportunities to ask questions throughout the presentation and at the end of the training. CMS and training personnel are here to assist with any questions you may have. Additionally, we will be looking at a lot of information today. This is to give you an idea how MACPro works, and we recognize that this will be a good amount of information to take in. Therefore, we will also be providing today's slides following this training. Also, these slides, the video recording of this session, and a quick start guide to assist you in using MACPro will be placed on Medicaid.gov in the future. And once this is available on Medicaid.gov, you will receive a notification from the MACPro Help Desk to let you know. And again, this is going to be a long session. We will be having a short break towards the middle. So our agenda today includes a brief synopsis of MACPro state user roles and the conversion from MMDL to MACPro, an overview of creating, reviewing, and submitting a Health Home SPA submission package, and a step-by-step demonstration of the workflow within the MACPro system. The webinar will end with some information about how to contact the MACPro Help Desk to obtain technical assistance, next steps on getting started in MACPro, and a final opportunity to ask questions. Additionally, there is an appendix with some extra information for your future reference at the end of this PowerPoint. So now let's briefly review the roles available to states in the MACPro system. For those of you who attended the roles training last week, this will be familiar. A number of distinct roles have been established for states within MACPro. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPro differ from those that are used in CMS's other web-based systems. And in some applications, this is the first time that there are roles. This slide lists the 4 Health Home SPA roles for state users in MACPro. The state editor is responsible for building submission packages. The State Point of Contact, or SPOC, is responsible for reviewing, editing, and submitting submission packages. The State Director conducts the final review of and certifies the submission packages. And the State System Administrator, or State Admin, is an administrative role that approves and modifies state user roles. We would like to note that in this initial release, the range of the State Admin's activities may be limited. However, it will expand over time. Additionally, the state admin maintains the state profile, which you will see shortly. A state user may have more than one role in MACPro, with the exception of the state system administrator. With this release, individuals with the state system administrator role can only hold that role. It is important to note that all state roles must be filled for proper workflow functionality, which we will see later on in this training. So now let's briefly review the conversion from the Medicaid Model Data Lab, or MMDL, to MACPro. The data in MMDL from approved Health Home SPAs will be copied into MACPro Health Home templates for states to use as the basis for future amendments. States will find the MACPro screens pre-populated with the currently approved information, except where the MMDL and MACPro templates differ. Additionally, the official and complete copy of all Health Home SPAs approved in MMDL may be viewed in MACPro as PDFs. Health Home SPAs currently being processed in MMDL will be completed in MMDL. And once the MACPro Health Homes application is operational, CMS will announce a date by which the last submissions can be made in MMDL. Finally, when subsequent SPAs are submitted and approved in MACPro, they become the official record of the Health Homes program. So now let's discuss how working in MMDL and MACPro will differ for those of you who are currently working in the MMDL. So here are some features that will impact how your work will be done. First, you will now have the ability to save your work without validating so that you may return to finish later on. Next, you may copy from an existing SPA. That way you can update information rather than inputting information twice if two submissions will be very similar. Additionally, it's now possible to submit an amendment for a specific reviewable unit. This is likely new terminology for you, and we will review this in further detail throughout this training. Reviewable units are essentially what you may consider sections within the MMDL. Finally, there is the ability to save communication between CMS and the state using a feature called the correspondence log, which is associated with the record of the submission package. We will also look at this once we get into the system. Next, we'll review the state submission workflow. This will give you a general idea of the players involved and the steps associated with submitting a state plan amendment to CMS. We will be going through these steps in the MACPro training environment today, so let's walk through the workflow to familiarize ourselves with the process before jumping into the system. For those of you who attended last week's role training, this will be familiar. First, the state editor creates the SPA submission package and completes and validates the reviewable units. Then, the state editor sends the package to the state point of contact or SPOC for review. The state point of contact reviews the package and includes any needed updates. The state point of contact may return the package to the state editor for further edits if needed. If not, the state point of contact forwards to the state director for review and certification. The state director then reviews the package, but they cannot edit the information. If edits are needed, the state director may return the package to the state point of contact. Assuming the state director certifies the package is sent to the state point of contact for submission to CMS. The state point of contact then can submit the package. However, if they notice changes are needed, they may select to edit the package, but they would need to resend it for certification by the state director if they did so. So next, we'll review the state submission process in more detail within the MACPro system. Today's system demonstration will cover the steps that we just reviewed within the state workflow. Additionally, we will discuss how to create or update the state profile, how to respond to clarification requests, known as unlocks in MMDL, how to respond to REI requests or requests for additional information from CMS, how to create a Health Homes program versus a program amendment, how to convert a draft submission package to official, where to find the Medicaid state plan record within MACPro, and MACPro reports available. So now let's move into the MACPro training environment, and we will start by working on the state profile as the state system administrator. So now we're switching to the MACPro training environment. We had already logged in as the state system administrator while I was talking to myself. And we are working in the training environment today, so therefore the information you see during this training is arbitrary information only being used for training purposes. Additionally, we're going to be using Iowa throughout this demo, but this is not a reflection of Iowa or their health home information in any way. When you first log into MACPro, you are taken to your news page, and this page operates similarly to a social media platform. You can write a post for your team, send a message to an individual, send a task to an individual, or recognize someone by providing them kudos from the text box located at the top of the page. Additionally, activities related to the package you are working on or ones that you are associated with are listed for your reference. State admins don't work with many packages, so their news page looks pretty bare, but you'll see some more full news pages as we move on. So we are beginning our demo with the state system administrator because prior to beginning the submission process, the state administrator must create a state profile. The state profile includes information in MACPro about each state that is referenced for each submission. The state profile includes many of the same functions as the current CMS Form 179. To begin, select Actions on the upper toolbar. The upper toolbar includes important for general navigation within MACPro, and each tab serves a different purpose. The Actions tab is for initiating new actions such as creating a submission package. There is also a News tab, which is a location that provides general status updates on packages and can be used for informal communication about packages between different MACPro users. Then there is the Tasks tab, which is where specific actions as part of the workflow will populate for you to work on. Tasks are activities that are needed to keep the package moving through the workflow, such as reviewing or responding to an REI request. Then you'll notice there is a Records tab. This is where you can go to reference submission packages that are complete or in progress. And finally, there is the Reports tab, which can be used for tracking different activities within MACPro. We will explore each tab in further detail throughout this training. I also know that could be something that's a little bit hard to remember, so explanations of each of these tabs are included in the appendix of the PowerPoint. So while we are looking at the upper toolbar, I'd like to point out the Training State Admin Iowa name that's over here on the right-hand side. This is what we are using during training as our first and last name. And this is just because we're working in the training environment. So we're going to pretend that my parents named me Training State Admin Iowa. But when you log into MACPro, you would see your name. So if I was logging in, I would see Katie Lane in this little welcome banner section. So while we are on the Actions page, we're going to select Create State Profile. This is where the state system administrator would go the first time they log into MACPro to create the state profile. Once it's created, the information will be populated into submission packages as they are created by the state editor. And since we have packages already created in the training environment, the state profile has already been populated, and we receive a message on the screen that a profile already exists for Iowa. So this state profile only needs to be created once. And from here on out, the only time it needs to be worked on by the state admin is if there are changes or updates to that state profile. But it's important because this information is populated within your state plan amendments you're submitting, and this needs to be done first. So click here to view or edit the profile. Notice at the top of the page that Records is now underlined in yellow. Since we are not creating something but are instead referencing something already created, MACPro shifted us from the Actions section to the Records section. As you can see here, the state profile includes basic information including addresses, contacts and their associated information. If we scroll down, we'll see some CHIP and Medicare information, as well as some public notice methods. If we wanted to edit this page as the state system administrator, we could do that at the top of the page by selecting Update State Profile on the right-hand side. So we will not be doing that today. And we're going to now move on to logging in as the state editor to get started creating our submission package. So now we are logging into the system as the state editor to create a submission package that it will eventually be sent to CMS. As a reminder, we are working in the training environment today, and the information that you see during this training is arbitrary information only being used for training purposes. Like when we logged in as the state system admin, The state editor is also first taken to their news page. This page operates similarly to a social media platform, as I just explained. And activities related to packages you're working on are listed for your reference. So as you can see here, there's a little bit of package instructions for a specific package, and that's something that the state system admin did not have. So now let's get started by selecting Actions on the upper toolbar. As a reminder, the Actions tab includes various activities that you could complete as the state editor in Iowa. You will notice that there are some quality measure actions included. You will only be able to access these links if you also have access to the specific quality measures authority in addition to Health Homes. So for Health Homes spas, anything that is submitted to CMS begins as a submission package. A submission package is a conglomeration of reviewable units or sections that make up a submission that CMS will review, in this case, a state plan amendment. Select Create Submission Package to get started. This takes you to the Submission Summary Reviewable Unit. Consider this as the cover page to what your state will send to CMS. It includes information such as the summary, statute or regulation citations, submission type, and contact information. This page must be filled out for all submission packages sent to CMS within MACPro. Before we get started filling out this information, notice at the top of the page there is a timeline. This will be at the top of each page or unit that you fill out within your submission package. The timeline will not be marked as complete until the information on the page has been entered and validated. The upper part of this page also includes package header information. This will update as we fill out the fields. Additionally, there is a link to the implementation guides in the right-hand corner. This guide provides explanations of the components of the page along with review criteria. We encourage you to utilize the implementation guides to assist you in completing your submission packages within MACPro. So now let's begin entering our information. In order to avoid extra clicking, select View All Responses directly underneath the View Implementation Guide link. This expands each section of the page, and you may choose to minimize or maximize the sections by selecting the small plus or minus buttons in the upper right corners of each section. So the first two sections are already completed and cannot be edited. This is based on what is available in MACPro at this time and what was populated into your state profile. The next section is the submission type. This is an important section where you may determine if you are creating a draft or an official submission. At this time, we will create a draft submission. The draft submission process allows your state to submit to CMS for review outside of the 90-day clock. Once you're ready to submit and start the 90-day clock, the state will convert the package to an official submission and send to CMS for review and approval or RAI, etc. This is an option to create the package as there is an option to create the package as an official submission originally. If your submission package is sent to CMS as a draft, CMS will not be able to approve your SPA until it is sent back to you and converted to an official package. If you originally submit the package to CMS as an official submission, CMS will be capable of providing a disposition, such as approval, and the package will be tracked within the 90-day policy clock. The distinguishing of the package between either draft or official can be changed up to the point that the package is submitted to CMS. We will discuss this concept of draft versus official packages in more detail when we return to the PowerPoint. And everything I just said is written there, so if you're frantically writing down what I just said, do not worry about it. So next we will allow the state to view our SPA. And then complete the key contact section by adding a key contact to the table. Select the blue Add Key Contact link below the table and then select an individual from the drop-down, in this case, Sarah Jones. This list is populated from information in the state profile. Again, this is a reason why the state profile has to be made before you do this. If this needs to be updated, reach out to your state system administrator for them to update the key contact information. And as a reminder, only the state system administrator may update the state profile information. So next we're going to fill out the executive summary portion. There is a text box available for the summary description, including goals and objectives. At the bottom left corner of the text box, there's a gray character count telling us that we have up to 4,000 characters that we may include in the section. And to save time during this training, we will enter some basic information into the text boxes. So here we're going to enter summary. I would hope that your summary is slightly longer than ours. And next we're going to fill out the dependency description section. The dependency description section may be used in a situation when the SPA you are submitting has a connection to another SPA that is either also being submitted or has already been submitted. Indicating the connection in this section assists CMS in ensuring that both are reviewed together. As an example, this situation may arise between an 1115 or managed care waiver and health home SPA submission. For this training, we will enter dependency into the text box. Next, select that the submission is not disaster related and include the federal budget impact. Our first fiscal year will be 2014. And once we click out of that, we'll see that our second year is automatically populated with the year following, which was 2015. And we're going to put some corresponding amounts in. We're going to put $100,000 and then $125,000. And again, these are arbitrary numbers and are not a reflection of Iowa or their health homes program at all. So next, complete the federal statute regulation citation section. We're just going to enter statute for this training. And then finally include the governor's office review, and we're going to select no response within 45 days. Once the draft package is converted to an official submission package, we will add the proposed effective date for the program along with the SPA ID. For now, we will save and return to the section later to complete and validate it. So this is the only reviewable unit setup that you cannot validate right away. We need to fill out another reviewable unit and then return to validate this unit later on. So we're going to move on to the next reviewable unit. And before we do that, I wanted to point out at the top of the page that the submission summary page is now marked as in progress on the timeline. And the reviewable unit is not marked complete until the information is saved and validated. Right now it's marked as in progress because we saved the information but did not validate it. So this is a reminder to let you know, hey, you have worked on this, but you probably need to come back here and look at it again. So now we're going to continue to the next reviewable unit, and we're going to scroll to the bottom of the page, and we're going to choose the next section in the drop-down list. As a reminder, each section is known as a reviewable unit, and there are submission reviewable units with every submission package, and more reviewable units will populate soon depending on our answers to this next reviewable unit, which is the Submission Medicaid State Plan. So we're going to select Submission Medicaid State Plan and navigate to that page. Again, our timeline is at the top of the page in the Not Started status. Additionally, our package header has been updated based on the information included in the previous submission summary reviewable unit. Notice that there is a package ID, and the package ID consists of the two-letter state abbreviation, the year, the authority, in this case MH for Medicaid Health Homes, an automatic number assignment, and the letter O for official or D for draft. So in this case we have a D because we indicated we have a draft. The package ID is used to track this submission package. This reviewable unit has one section, and the goal is to determine the submission package's purpose. Since Health Homes is the only authority in MACPro for submission packages at this time, that is automatically checked off. Then your state has the ability to choose to either create a new health home program, amend an existing program, or terminate an existing program. We will start off by showing how to create a new health homes program, and further along in the training, we will go over how to amend an existing program. How to terminate an existing health homes program will be included in a future quick start guide for your reference. So once we selected create a new health homes program, two options became available. MACPro is dynamic, and your selections will impact what options you may select. If you have an existing program that you'd like to pull heavily from, you may use the copy function and tweak as needed. Alternatively, you may create a new program from a blank form. So we're going to start off with a blank form, but we will move to a submission package that's already been filled out to save time during today's training in a few minutes. So enter the name of the Health Homes program. For this training, we're going to enter HH program and today's date, which is March 22nd, 2016. And now that we've entered this information, click Save Reviewable Unit. Yes was pre-populated for validation in this reviewable unit because there is only one subsection to complete on this page. Once this is saved, your Health Homes specific reviewable units will become available in the reviewable unit drop-down list. So as you can see here, our options available have significantly increased, and we now have more sections or reviewable units to complete that are specific for a Health Homes program. We're going to continue on to another reviewable unit. Once the Medicaid State Plan reviewable unit is complete, it's not necessary to complete the other reviewable units in a specific order. For this training, we will skip the other submission-specific reviewable units to save time, as they are rather straightforward. And next, we will move on to the Health Homes reviewable units, which begin with Health Homes in the drop-down list. Select Health Homes, Population and Enrollment Criteria, and click Go to Selected Reviewable Unit. First, select View All Responses. As you may remember, this saves us from clicking Open for each of the sections within this page. Categorically needy, mandatory, and options for coverage. Eligibility groups is automatically checked off, and you have the option of selecting medically needy eligibility groups as well. Next, complete the population criteria. We will select 2 or more chronic conditions, then mental health condition and substance abuse disorder. You may select 1 or more options because these are checkboxes. Then we will complete the enrollment of participants portion, and we will select Opt-in to Health Homes Provider. This causes a description text box to appear. Remember, MACPro is dynamic, and more fields may become available depending on your selections. We will write in the text box description because, as I mentioned earlier, we're only including some short examples of what you would enter into the text boxes. And again, this is the training environment, so this is arbitrary information, and nothing entered in here today is a reflection of Iowa. Now that we've finished this section, let's select Yes to validate, and then save. Remember that this reviewable unit will not be marked as complete until it's both been validated and saved. And if you can notice on the timeline, we are now in the complete status. Then scroll to the bottom of the page And now let's select the reviewable unit we will look at today. We're going to look at Health Home's geographic limitations, and then we're going to click Go to Selected Reviewable Unit. First, select the third option. Health Home services will be provided in a geographic phased-in approach. This causes more options to become available. Again, remember that MACPro is dynamic. First, we will include a phase into the table provided by selecting Add Phase in the bottom right corner of the table. This takes us to a new page to add the phase. Let's first select an implementation date, which we'll put as tomorrow, so the 23rd. Then we're going to put that we're going to do it by county. And we're going to type in Des Moines as our specific county that we're going to be including. Next, select No for if it's available statewide. And then we're going to enter, you could enter any narrative to fully describe the phase for this training. But as you can see, I'm going to point out on this page that not every field in MACPro is required. And you can determine if something is required by the small red asterisks at the end of the question. And as you can see at the end of this text box that there is not a red asterisk. And generally anything that's additional information is optional. CMS thinks it will be rare that a document will need to be uploaded from this field. However, we will upload one for this training to show you how this functionality works. So select Browse. Then we're going to choose a MACPro dummy PDF that we have here, just called MACPro Demo. And we're going to wait for that to upload. Once it does upload, we're going to select Save Documents in the bottom right corner. You have to save the documents first. And this could take a few seconds. And we're going to refresh this page. This is something that you'll be taken to. It could take a few moments for it to refresh. And once it does, it'll return you to this page, and as you can see, your document has been uploaded. If you had several documents, they'd be listed here in a table format. So next, let's save this phase. And this returns us to the reviewable unit that we were working on. But if you can see, we're not able to save. And it looks like we need to re-add some information in. Again, this could just be because we're working in the training environment, so bear with us here. We're going to go down and save the phase. It looks like we're having a little bit of technical difficulty here. This is just due to being in the training environment. We'll try this one more time. And there we go. So now we have our phase, and this is a good moment to plug. If you're having any trouble in the MACPro environment, there is help out there for you. Well, you can reach out to the help desk, and we will be providing their email address and phone number. But again, that specific situation is because we're working in a training environment. It's slightly different than the environment that you will be working in. So we're going to go down here and select yes, that we would like to validate this reviewable unit. And then we're going to save our reviewable unit. As you can see at the top of the timeline, we're now incomplete. And to be efficient with our time in this training, we're going to move to a draft submission package that has already been filled out and validated by the state editor.